Let me pick up on a couple of words that I guess I heard you just now in your testimony, that the insurers, in terms of increased premiums, are only going to see increases in premiums in the single digits. Is that what your testimony said?
That's correct.
Okay. So in a way that I guess this whole ACA was supposed to reduce health care costs, now we're happy that the increases are only in the single digits, so we need to say that relatively it's not double digits. So that's why we're happy about it?
We're extremely happy. Again, what we're seeing right now are proposed rates in the single digits, and that means a process needs to go forward at the state level around rate review, and states will certainly, the departments of insurance at the state level will certainly scrutinize those.
So single digits being low single digits or high single digits?
We're seeing some places where there's even a decrease.
I mean, overall. I mean, we're looking at this. Yep. Overall, what are you anticipating?
We're looking at single digits. So I think time will tell. Again, we're early in the process. What we're very happy to see is proposed rates that are in the single digits. So
we're happy that our rates were supposed to go down by $2,500 a family, and we're happy that they're only going up by single digits.
I think if you look at what rates were prior to the Affordable Care Act and the rate increases historically, we're very happy.
Okay. Now, you mentioned one other thing, and that is competition in your testimony. How do you think that we have additional competition? And let me tell you the reason why. Is my son is looking potentially to start a family, get married. So I said, what I'd really like you to do is go out and get some quotes for medical insurance to make sure that you're providing for your family. And they told him, the insurer said, well, we can't really give you quotes. You need to go on healthcare.gov. How do you see that as competitive?
So, with the health insurance market launching this past year, it's the first time that consumers were able to go to one place and compare apples to apples the types of insurance products that be available to them. And obviously that is the portal where many folks, more than 85% of those 8 million Americans, got financial assistance to make premiums even more affordable.
But they're not, Dr. Cohen. I mean, I'm on Obamacare now. My premium is not less than it was. My coverage is not as good in some places. And honestly, some of my coverage, I have to buy things that we would never use, like maternity coverage, just because of our age. Is that part of what you've factored in, is that we'll have to buy things that we'll never use, and that's how we pay for this?
So as you know, part of the intent of the law, again, is to give access to affordable coverage for millions of Americans, and setting a floor for coverage where we have folks who can purchase plans that provide essential benefits for everyone.
That didn't answer my question. That's a great answer, but that wasn't my question. My question is do Americans have to buy coverage on things that they will never use, like maternity coverage that we will never use? Do you have to do that in order to make this thing pay?
So I think the great thing about the marketplace, again, is the transparency that it brings and allowing.
I didn't ask about transparency. I asked yes or no. Do you have to buy a product that you will never use to make it work?
So
yes or no?
We have 10 essential health benefits. Maternity is one of those.
And so you have to buy maternity even though you may never have a child?
That is correct.
All right. Are there other things that you have to buy that you may never use?
It depends on your personal family situation, your medical situation. I'll say as an internist, a primary care doc, sometimes you don't know what that medical situation will be going forward, and that's the nature.
But maternity is one that you can probably analyze pretty well for somebody that is in their 50s.
Right, but it's a minimal essential benefit that we wanted to make sure that all Americans had access to.
All right, so you wanted to make sure that they had a benefit that they wouldn't use.
Wanted to make sure that all Americans had access to some essential health benefits.
All right, I yield back. Thank you, Mr. Chairman.